so far I think people have been diagnosing things, and they work with what I call generic frameworks. So they say, okay, this is a Parkinsonian condition and these are the things I do. I use the drugs, or I use advanced therapies, or I go for deep brain stimulation, surgery, etc. But I think soon we'll have genetically based or biomarker-based diagnosis, and you may be having advanced treatments which are meant for that particular genetic condition, perhaps even disease-modifying treatments and so on. So when people say, is there a cure, what is the difference is it going to make to my standard practice? I feel that in the near future, because of the advances in the genetics and biomarkers, there will be more precision medicine, and it will be required mandatorily that we don't miss out doing it. And we're already seeing that. So for example, if you've got a patient with dystonia and you send them for DBS, certain genes will do better than other genes. So if you haven't done the genetic diagnosis in them, and then you find for some reason the patient isn't better after your DBS, now whose fault is that? So people have to recognize this. I think that precision medicine is already there, and is going to grow even more. I was showing this morning about a very rare condition, but a very important, important that it could be treated with an adenovector insertion of the gene directly into the putamen in the brain, so this is a condition called AADC deficiency, and it happens in childhood with people with and they get dystonia and oculomotor abnormality, and this could be reversed in this particular study. So I think from those lines there will be a similar sort of genetically based translational treatments which are based on pathophysiology, and we're going to see more of that.